In our health alert tonight, new mammogram screening guidelines have been issued, and this time from a breast surgeons group.
These guidelines are very different from what the American Cancer Society recommended. So we brought in our chief health editor, Dr.Nandi, to show us the differences. Doctor?
Alan, so these recommendations come directly from the primary leadership organizations for surgeons who treat breast disease, and that's the American Society of Breast Surgeons. Day after day, they're on the front lines and see firsthand how early screenings can actually save lives. So what is this group actually recommending? First of all, they would like all women to have a formal breast cancer risk assessment by age 25. And then if a woman is found to be an average risk patient, this group recommends yearly screening starting at the age of 40. Now, if you determine that a woman has a predicted lifetime breast cancer risk of 20% or higher, then mammogram screenings along with MRI imaging, also if needed, are recommended to start at age 35. And for women with a higher risk due to hereditary susceptibility genes, then annual MRIs can begin at age 25, followed by annual mammograms at age 30. So really quite different recommendations than we've seen before.
So, Doc, the U.S. Preventive Services Task Force recommends the first mammogram screening at 50 years of age. And the American Cancer Society recommends age 45. So why is this group recommending something different?
So Glenda, it's because a one-size-fits-all approach really doesn't work anymore. The age of mammograms was actually revised about 10 years ago by the U.S. Preventive Task Force because of false positives and results for the potential for unnecessary anxiety, pain, and complications from additional testing. But the American Society of Breast Surgeons prefers to look at an individual risk assessment and then make recommendations based on that. And this will hopefully help a subset of women who are more likely to die of breast cancer due to later screenings. The breast surgeons group says that routine screening for women aged 40 to 49 has shown to reduce deaths by 15%. That's really important. And to me, that makes a lot of sense because we know when breast cancer is caught early, you increase the odds of a woman successfully beating it. I know personally I have at least 2 members of my family, if they were not checked between the age of 40 and 49, they may not be alive today. So that's why this is so important, what they're doing, and I love that they're taking a stance.
Some good information for sure. All right, Doc, thank you so much.
My pleasure.
And if you have a question or a health concern for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or be sure to send it to us on Facebook or Twitter.